Hits you love.
Feel good vibes and great music.
Oh, yeah.
This is Radio 44. Your music, your life.
Even the other stations are listening.
Right now, we do have Dr. Parikh in the studios with us. Of course, he's a retina expert and an ophthalmologist from IND Hospital. Good morning to you, sir. Thank you for joining us.
Good morning.
All right. So, you know what? Of course, when it comes to diabetes and eye care, there's so many people don't know so much about this. You know, we read a few things on the internet and that's it. So I think we see the TikTok and the Instagram doctors, but it's always good to have an actual doctor, an actual expert, opinion.
Absolutely right.
So let's go straight into it. First of all, of course, we know diabetes is a global matter, but can you provide some insights into, how big diabetes is in Kenya and its impact on eye health?
Yes, so diabetes is really becoming an epidemic, not in Kenya, but all over the world. Now, it is assumed that currently there are almost 2.5 million diabetic patients in the Kenya. And according to one study, almost 27% of the total death in Kenya, it is because of just diabetes. Now, if you consider an eye problem, out of 5 or 6 diabetic patients, one patient will develop some form of eye damage or severe diabetic retinopathy, which can cause swelling on retina, and sometimes it can cause a massive bleeding in your eye. Not only that, if these conditions are neglected, it can cause even retinal detachment, which can cause severe vision loss and blindness to that person. So this is the magnitude of diabetes in Kenya.
My God, that just scared me right there. Good Lord. Okay. So a lot of people with diabetes may not be fully aware of the risks, like what you mentioned, the risk to their retina, overall, the eye health and everything. So the question is, how can we, improve the awareness among diabetic patients, and what's the importance of regular eye checkups?
Yeah, that's very true. The awareness is very important to prevent the further vision loss in a diabetic patients. Sometimes it really feels sad when patient comes to us and we have to inform the patient that you have diabetes since long time. And unfortunately, the damage is so severe that even with the surgery, we cannot correct your vision. So for the best thing, the early checkup for diabetes is very, very important. Now at INU, we have a strict protocol of asking each and every person who comes for the eye checkup whether you have diabetes or not. Even the patient comes to us for a regular glass checkup. Then we inform the patients, do you have diabetes? Because your complete eye checkup and retina checkup is mandatory. So at least that person can educate their family members. Oh, my father is diabetes, so I must take him to the retina specialist doctor. That's why we can create an awareness for diabetes. Not only that, but our diabetologist colleagues and physician doctors, they have to play a very important role in educating their patients that if the patient is diabetes, then they must tell the patients that you should consult your eye specialist or a retina specialist for diabetes checkup. But the good thing is that things are slowly but gradually improving. Nowadays, we see a lot of patients who are coming to us and they say, Doctor, I am having diabetes. Can you check my retina? So that is a very good sign.
That's a good sign. And that's exactly why I think, such conversations that we can have as well do matter. Keep it right here on Radio 44. For now, we're taking a short break, of course, a musical break. But feel free to send in your questions. I've already got 2 of them right now on 0758 123 444. So you can get into the conversation with Dr. Parikh. Keep it right here on Radio 44. Sachet and Parampara Tandon with that beautiful beautiful, beautiful track playing right here on Radio 44. Of course, you could enjoy the music videos and this interview by simply going to radio44.co.ke. But of course, to enjoy these music videos, you do need good vision, and that's why we do have Dr. Parikh right here, a retina expert from I&U Hospital, and we're talking about the impact of diabetes on the eye. So, doctor, preventing diabetes-related blindness, that's a huge concern, very important. Now, what lifestyle changes or what measures would you recommend to people with diabetes to actually protect their vision?
So as you know that diabetes is a lifestyle disease, and apart from taking your medicines and insulin, it is very, very important to change your lifestyle to control your sugar. Now diabetes, hypertension and cholesterol, this together makes a very dangerous trio. So the only thing is to change your lifestyle. You can have healthy diet. You can avoid the three white things: the sugar, the salt and the white refined flour. That is very dangerous for your diabetes.
Flour as well, huh?
Yes, of course. And then you can include a lot of green vegetables in your diet. You can avoid the sweet fruits, but then you can have the citrus fruits in your diet. That can also control your sugar. But the most important thing is to avoid any smoking. That is also very dangerous, not only for the eye, but for your heart and your brain also. And one more important thing to change your lifestyle, do at least some kind of physical activity, like at least spend 20 or 30 minutes either for your walk or jogging, or have some good habit of playing sports. And this way you can reduce your sugar, your blood pressure and your cholesterol, and this damage you can keep miles away from you by changing your lifestyle.
Good Lord. Okay. Of course, we all know that when it comes to, commitment to the treatment of retinopathy, I&U Hospital is all the way up there, and you have been for a very long time. Could you elaborate on some of the specialized approaches or programs, that you guys have in place, to address the unique needs of patients with diabetes in your hospital?
So I&U have special approach for awareness program related to diabetes and diabetes related eye problems. Now we regularly do the seminars regarding diabetic retinopathy. We usually approach the communities and we arrange a seminar and a one-to-one talk with the people who are having diabetes. This way they can get the information that diabetes can damage the eye also, and thus we can spread the awareness of diabetic retinopathy. In fact, the next program of diabetic retinopathy screening camp, it is at Nakuru Clinic. It's on 24th of February. And usually these seminars and talk, it is followed by complimentary eye and retina checkup at I&U Hospital.
Oh, lovely. Okay, so we've also got a message over here from Sheila. Sheila is asking, is there a situation in your 70s, in the age of the 70s, where, your sight cannot be improved? Is there any reason why it cannot be improved?
So we have to check what is the exact condition. At the age of 70 years, if it is because of old age, it is a macular degeneration, or it is because of optic atrophy, that means complete drying of the optic nerve which connects the eye and brain, then that can be the probable reason for that.
Okay, and in the latter case that you just mentioned, is
unfortunately, in any part of the world, you cannot correct the optic nerve dysfunction.
Oh, God. Okay. All right. Thank you so much. Of course, the conversation is still ongoing. 0758 123 444. If you have any questions, feel free to send them in right now. Going into some Sonu Nigam and Shreya Ghoshal. Now, we still are in the studio with Dr. Shaileen Parikh, who's an expert when it comes to your retina and, of course, at INU Hospital. The conversation goes on. We're talking about, of course, diabetes and, your eyes health. And, Doctor, right now, of course, we have well established that early detection is very important, especially in managing diabetic retinopathy. Now, what screening methods does INU Hospital have, to identify potential eye issues in patients with diabetes at, possibly the earliest stage? What do you have?
So at INU Hospital, we have a very strict protocol of doing complete eye examination, including retina examination for all diabetic patients. Now, most of the diabetic patients, if they are in very early stage of retinopathy, they don't have any symptoms. They usually argue with us, my vision is normal, how can I have retina problem? But so many times, if we dilate the eyes of those patients and if we check the retina, we can see lot of damages going on inside the retina, which usually do not have any symptoms, and that is more dangerous. So once we diagnose the diabetic retinopathy, we do certain investigations like CT scan and angiography of the eye. Now, I'm very sure you must have heard about the CT scan of the brain and angiography of the heart. Is it right?
Yes, absolutely.
Yeah. So at INU Hospital, we do have angiography and CT scan for the eye also, which can even diagnose the earliest form of diabetic retinopathy, which can guide us for the further treatment of diabetic retinopathy. Not only that, in future, we are also planning that we go with a van with some good camera of the retina. We want to reach the remote areas of Kenya in which the people are not aware about the diabetes and diabetic retinopathy. So our technician can take a picture of retina and then sends the image to the main hospitals, and at the main hospital I can screen those images, and those who are having diabetic retinopathy then come to the INU Nairobi for further treatment.
That's absolutely phenomenal. Now, of course, we had mentioned something about the detachment of the retina. The question is, what exactly is that? How does it happen?
So classically, the detachment is separation of the retina from its eye wall.
Okay.
We see because of retina only. The retina sends signal to the brain via optic nerve. So if that retina is not in normal position and it is separated from its eye wall, then definitely the signals are not going to pass to the brain, and that patient probably cannot see because of the retinal detachment, which is very common in advanced stage of diabetic retinopathy.
So that is like the worst thing to happen,
yes,
basically.
Absolutely right.
Good Lord. Okay, now considering we're seeing advancements in every aspect of the world, including the medical world right now. So are there any innovative treatments or procedures that, IND Hospital, uses when it comes to, diabetic patients and, anyone experiencing retinopathy?
So we have very advanced medical technology for treatment of diabetic retinopathy and its complication. Now, if it is in very early stage, we can treat such eyes with the help of laser. Now, laser takes only 5 to 10 minutes per eye session, and you don't have to do any post-procedure follow-ups or any post-procedure restrictions. You can just go home and do your all regular activities.
Okay.
Sometimes with the newer injections, we can treat the swellings in the retina. Now that injection also takes 2 minutes. So if your diabetic retinopathy we diagnose at very early stage, within just 2 or 5 minutes of the procedure, without any post-procedure restrictions, you can do all your work, you can have very good vision. Unfortunately, we see lot of patients in advanced form of diabetic retinopathy which require only surgery. So we do have very state-of-art advanced surgical system in which even the complicated surgeries we can finish in 45 minutes to 50 minutes without taking a single suture, and that can restore the most of the vision in most of the patient if the patient comes to us very early. So my only advice is early and regular eye checkup and retina checkup, and strict no to vision loss and blindness.
Excellent. Just for my sake, for my understanding, because I think I'm a complete layman when it comes to all this. Now, if let's say I have detected this early, and I'm at the early stages where we can do these procedures, how often would I have to be doing them?
So, if your sugar is under very good control and you don't have any other risk factors like blood pressure, cholesterol, or smoking, then probably 1 or 2 sessions they are sufficient for you. But then, if your sugar is not under control, you have to take insulin, then probably the multiple sessions, at least 3 or 4 sessions of this laser and injections are required.
Excellent stuff. Thank you so much, Dr. Shaileen. I think it's how do I say it? You literally created a new vision for all of us in understanding the dangers of diabetes, and of course, the most important thing being early detection and at the right place at INU Hospital.
My pleasure, and thank you very much to you also.
Have a good day, sir.
Yeah, have a good day to you also. Thank you.
The hits you love.
Feel good vibes and great music.
Oh, yeah.
This is Radio 44. Your music, your life.
Even the other stations are listening.